Hey guys, Jim here. Welcome back to our Pediatric Echocardiography Registry review. Let's keep rocking this test. Which of the following is true regarding these types of tumors? A, they tend to spread to other areas of the body if not treated immediately. B, they are the second most common tumors in children. C, they more commonly grow on semilunar valves. Or D, they typically regress over time. The answer is D. They typically regress over time. These are called rhabdomyomas or rhabdomyoma tumors. These are the most common tumors you will find in children. Which of the following is the correct blood pathway for this patient who has HLHS or hypoplastic left heart syndrome? A, inferior vena cava to the right atrium, to the left atrium, to the left ventricle, to the aorta, to the patent ductus arteriosus. B, pulmonary veins to the left atrium, to the left ventricle, to the aorta, to the patent ductus arteriosus. C, superior vena cava to the right atrium, to the left atrium, to the left ventricle, to the aorta, to the patent ductus arteriosus. Or D, pulmonary veins to the left atrium, to the right atrium, to the right ventricle, to the pulmonary artery, to the patent ductus arteriosus. The answer is D. Blood flow will go from the pulmonary veins to the left atrium, to the right atrium, to the right ventricle, to the pulmonary artery, and then through the patent ductus arteriosus. This patient has pulmonary atresia with an intact ventricular septum. What needs to be present to stay alive? A, right to left PDA. B, left to right PDA. C, left to right ASD. Or D, close ASD to prevent mixing. The answer is B, left to right PDA. Which of the following surgeries is suitable for this patient? A, Damas K. Stanzel. B, Rastelli. C, Norwood. Or D, Jatine. The answer is B, Rastelli. So this patient here has Truncus arteriosus. So Rastelli will help close off that VSD. Then they'll put in a pulmonary artery banding that will connect the right ventricle to the pulmonary artery. Click on the descending aorta on this image of a patient who has an aortic coarctation. So where on this image is the descending aorta? The answer is right here. This is the descending aorta. Which of the following should you be concerned with when visualizing this echocardiogram? A, patent ductus arteriosus. B, persistent left superior vena cava. C, total anomalous pulmonary venous return. or D, dextrotransposition of the great arteries? The answer is C, total anomalous pulmonary venous return. You can tell because the left ventricle is completely compressed by the right ventricle. The right ventricle is severely enlarged because all 4 pulmonary veins are going towards the right side. So the right side is severely volume overloaded. What type of defect is demonstrated here? A, ostium secundum, B, septum secundum, C, septum primum, or D, ostium primum? The answer is D, ostium primum. What type of condition is associated with this type of mitral valve? A, complete AV canal, B, rheumatic fever, C, HLHS, or D, aortic atresia? So this patient has a cleft mitral valve, which is something you can expect to see in someone who has a complete AV canal. This patient will most likely benefit from which surgery or procedure? A, anastomosis of the upper and lower segments of the aorta, B, ligation or transcatheter coil, C, Dacron transaortic closure, or D, pouch procedure? So this patient has an aortopulmonary window or an AP window, and the surgery they use to correct that is a Dacron transaortic closure. What are you most likely to see in this patient? A, severely dilated ascending aorta, B, coarctation, C, mitral valve prolapse, or D, Tetralogy of Fallot? The answer is B, coarctation. Okay, bonus question. What type of bicuspid valve is this? This is called the Raphe bicuspid aortic valve, where you'll have fusion of 2 of the aortic cusps. The most common defect associated with a bicuspid aortic valve is a coarctation. Based on these ultrasound findings, what defect does this patient have? A, double outlet right ventricle, B, Truncus arteriosus, C, dextrotransposition of the great arteries, or D, Tetralogy of Fallot? The answer is D. Tetralogy of Fallot. Patients who have TOF will have 4 defects. These include an overriding aorta, VSD, pulmonary stenosis or atresia, and right ventricular hypertrophy. Which of the following connections resembles this ultrasound? A. Concordant atrioventricular connection with concordant ventricular arterial connection. B. Discordant atrioventricular connection with concordant ventricular arterial connection. C. Concordant atrioventricular connection with discordant ventricular arterial connection. Or D. Discordant atrioventricular connection with discordant ventricular arterial connection. The answer is C. Concordant atrioventricular connection with discordant ventricular arterial connection. Which of the following is true regarding this echocardiogram? A. The functioning right ventricle is small. B. The atrial septal defect is mainly left to right. C. The pulmonary artery pressure is most likely high. Or D. The proximal RV wall is thick and continuous with the right atrium. So this patient has Ebstein's anomaly, and the answer is the functioning right ventricle is small. So right up here is the right ventricle. So basically the ventricle has become atrialized. Atrium is considered to be all of this with the right ventricle right here. This patient needs what to survive immediately following birth? A. Ibuprofen. B. Atrial septal closure. C. Prostaglandin for PDA. Or D. Fontan. The answer is C. Prostaglandin for PDA. This patient has HLHS or hypoplastic left heart syndrome, and they are ductal dependent, so they need to keep that ductus open with the use of prostaglandins. Click on the aorta on this image of a patient who just completed the 3rd step of the Norwood. So where's the aorta in this image? The answer is right here. This is the fontan and the aorta is right there. What type of shunt is demonstrated in this ultrasound? A. Gerbode. B. Supracrystal. C. Infracrystal. Or D. Inlet. The answer is A, Gerbode. All of the following cardiac chambers will dilate from this defect except A, left ventricle, B, right atrium, C, left atrium, or D, pulmonary artery. The answer is B, right atrium. So this is a muscular ventricular septal defect. This will cause the left ventricle, the left atrium, and the right ventricle to dilate, but the right atrium won't dilate whatsoever. Four months ago, this patient mainly had dilated chambers on the right side and fairly unchanged chambers on the left side. What has this patient been suffering from? A, large PDA, B, ARVD, or arrhythmogenic right ventricular dysplasia, C, Isomerism syndrome, or D, trabecular VSD. The answer is C, Isomerism syndrome. Which of the following is most commonly found with this defect? A, LTGA, or levotransposition of the great arteries, B, right aortic arch, C, bicuspid aortic valve, or D, VSD. So this patient has interrupted aortic arch, and the most common finding with this defect is a VSD. Which structure is dilated in this transesophageal echocardiogram? A, left atrial appendage, B, coronary sinus, C, aorta, or D, pulmonary vein. The answer is B, coronary sinus. The coronary sinus is right here. What else can you expect to see in this patient? A, double-chambered right ventricle, B, IAA or interrupted aortic arch, C, TAPVR or partial anomalous pulmonary venous return, or D, HLHS, hypoplastic left heart syndrome. The answer is C, partial anomalous pulmonary venous return. So this patient has a core triatriatum right here in the left atrium. This is an echocardiogram of a patient who has status post-coarctation repair. Which of the following is true regarding this ultrasound? A, the descending aorta is now aneurysmal. B, an aortic rupture is now present. C, the aortic arch is patent. Or D, there is still residual coarctation. The answer is C. The aortic arch is patent. Based on the findings in this ultrasound, this patient most likely has what? A. Ventricular septal defect. B. Partial AV canal. C. Endocardial Cushing defect. Or D. Total anomalous pulmonary venous return. So the answer is B, partial AV canal. There are two defects that will confirm a partial anomalous pulmonary venous return: a cleft mitral valve and a primum ASD. What's missing here to make this a complete AVSD or an endocardial Cushing defect is the primum VSD. Which structure is in the left atrium? A. Core triatriatum. B. Amplatz deploying catheter. C. Supramitral membrane. Or D. Pacemaker wire. The answer is C, supramitral membrane, which are super rare. Click on the transverse aortic arch on this image of a patient who has an aortic coarctation. So where is the transverse aortic arch? Where would you click on the transverse aortic arch? The answer is right here. So this is the ascending aorta, transverse, and the descending is down here. This is our bonus question. Just in case you're taking your boards anytime soon, you really need to know this question because I like to ask this a lot. Which view is best for demonstrating a left Blalock-Taussig shunt? A. Suprasternal high right peristernal with anterior tilt towards the left pulmonary artery. B. Suprasternal notch long axis with posterior tilt towards the left pulmonary artery. C. Suprasternal notch short axis with lateral tilt towards the left pulmonary artery. Or D. Suprasternal notch short axis with anterior tilt towards the left pulmonary artery. The answer is D, suprasternal notch short axis with anterior tilt towards the left pulmonary artery. Which view is best for demonstrating a Glenn shunt? A, suprasternal high right peristernal short axis. B, subcostal low right peristernal short axis. C, suprasternal high left peristernal short axis. Or D, apical four chamber with anterior tilt. The answer is A, suprasternal high right peristernal short axis. Well, that completes our next 25 questions of this pediatric echo review. I'll hurry and write 25 more questions and get that video uploaded as fast as possible. I'm Jim with ultrasoundboardreview.com. Thank you so much for watching.